my name is Doug Jung, and I am the physical therapist here at the Norfolk Veterans Home. And we are going to be talking about assisting a member off of the floor that has fallen. In this particular case, we're going to focus a bit on an obese member or someone that's a little bit more difficult to transfer. There are a few different scenarios that we're going to talk about today. In the scenarios that we're going to look at, we're going to assume that the individual is conscious. We're going to assume that they have not sustained any type of significant injury. And we're also going to assume that they are able to describe what has happened. Obviously, if the individual is unconscious and you enter their room, activate EMS and follow the standard operating procedures for someone that is unconscious. So in these particular scenarios, we're going to assume that the individual is conscious and they can describe what has happened to them. There are a few things that I think are very important that we need to focus on as we look through these scenarios. The first is that we protect the individual from further injury. The second is that we protect ourselves from further injury. In many cases, that member has fallen and we don't know what their cardiovascular status is. We don't know if they've sustained any other types of problems, if they have had a knee replacement or a hip replacement or anything like that. So we want to make sure that we protect them as much as possible. In some cases, they may have already tried to stand on their own and have basically just worn themselves out. So we also want to protect their cardiovascular system. As far as ourselves are concerned, we have the ability to utilize a lift and other individuals to protect ourselves from injuring ourselves any further. So that's how these scenarios are going to play out this morning. There are some questions that are also provided that are very straightforward that we will do our very best to try and cover. First scenario we have here, we have a member that has fallen. Maybe they're in the bathroom, maybe they're in the hallway, maybe they're transferring from their chair to the bed, whatever. And so in this particular case, they've gone to the floor and they have their walker here for support with them. Now, the first thing I'm going to do, are you okay? Do you have any injuries? You know, what's going on? I wouldn't necessarily assume that they're going to be able to explain those things to you, and I don't know that that's always reliable. So first thing I want to do is obviously check ABCs. If they can speak to me, their airway is open. Obviously, if they can speak to me, they're breathing, and obviously their circulation is going if they're able to maintain this position. So, have you hurt yourself? No, everything's okay. What happened? I don't know, my legs gave out, I fell straight to the floor. So in this particular case, I really don't feel comfortable having this person try to stand on their own. The very best scenario, in my opinion, is to have this person come all the way to the floor. Now, hopefully you've already hit the call light and you have some help coming, but let's assume that you don't. So in this position, I have a gait belt on the individual, which I put on prior to them falling. I feel more comfortable with a gait belt on if it's around. I think it's safer for myself and I think it's safer for the individual, so they have a point of contact with the patient other than their clothes or maybe a belt. So in this particular situation, I want to steady them. And from here, what we're going to do, I'm going to move the walker ahead and I'm going to have you come down on all fours. So you're going to put your hands on the floor. From that position, we're going to come out onto your stomach and we're going to roll you in one unit all the way onto your back. From that point then, I should have further assistance and I can utilize a Hoyer lift to get them up off of the floor. I would not utilize a sit to stand. I think a Hoyer lift is the safest to protect ourselves as well as protect the individual that's fallen. Again, we're assuming that there is no injury, but we're not exactly sure. Okay? So what we're going to do is we're just going to bring that ahead and I'm going to have you come onto your hands and knees. Okay? From this position though, we're going to go all the way out onto the floor. So you're going to come all the way forwards. Good, just like that. All right? Are you okay? Yep, everything's okay. I'm going to tuck this arm down to their side. All right? And we're going to roll them. In this scenario, the individual has tried to stand and they've either slid out of their chair or they've fallen after they've tried to get up. Same as the previous scenario. I'm going to assess ABCs, assuming that their airway is open, they're breathing, and that their heart is pumping. How did this happen? I stood up, I tried to take a few steps, my legs gave out, I fell flat down, I fell flat down onto my bottom. Are you hurt? Well, I don't know. In this situation with the population in this facility, there are several things that I would worry about. The most obvious thing would be a compression fracture through their spine or some injury to their spine. Again, I don't know that for sure, so I'm going to assume that those things happen until someone tells me that it didn't happen. So in this situation, rather than try and pull that individual forward, I'm going to ask for some assistance. I want to clear the obstruction or clear the chair or whatever it is that's behind them so that I can lay them flat backwards. From that position then, we have to decide how we're going to transfer that person. We may need to put a sheet underneath them and slide them forwards to get a lift around them. And that's where you kind of have to problem solve based on the situation. But the most important thing is that, again, we protect the individual and we protect ourselves from further injury. So in this particular scenario, let's say that we can move this chair and that we don't have to worry about any obstruction transferring them. If need be, you would have someone else come in and hold them in this position, remove the chair, or worst case scenario, we have to slide them forward. So place a sheet underneath them, slide them forwards, lay them down nice and gently. You may have a mat available, but certainly you're going to need some assistance as you do this. This should not be a one-person maneuver. So in this particular case, we're going to assume that we move the chair. So what I'm going to have you do, please, is I want you to lean forward for me if you can just a little bit. And I'm going to clear this obstruction. Hopefully I've got a pillow or something that I can lay back behind him. Are you having any pain? No, I feel okay. We're going to lay flat on your back. I'm going to support their head, and we're just going to go flat down onto the ground from here. From this position, again, I can place my lift underneath. I can roll them to one side, place it, roll them to the opposite side, slide it under, and transfer the patient back to sitting or into their bed. In our last scenario, we have someone that's fallen directly to the floor. First thing we're going to do, we're going to approach them, find out if they're conscious or unconscious. Obviously, if they're unconscious, we activate EMS and follow the standard operating procedures for an unconscious individual. We're going to assume in this case that they're conscious, that they're breathing, and that they can interact with us. We want to find out how this happened. We want to find out if they're okay, if they sustained any injury. Okay? Again, we're going to assume that they have not. We want to do a log roll flat onto their back. We want to stabilize their head as we do so. We're obviously going to ask for some help. We want at least 2 individuals as we do so. As in the very first scenario, we're going to ask them to bring their arm to their side so their arm is completely cleared. From here, we're going to log roll them onto the back, like so. If they can help us, that's great. If they can't help us, we're going to have 2 individuals with us that'll allow us to do that. So just to wrap up, we looked at 3 different scenarios as far as assisting an individual who has fallen. I know that there are all kinds of different variations in how exactly this happens, and each one has to be treated differently even though they're similar. You have to be able to problem solve what's the best and the safest for each particular situation. I do think it's worth note that if you have someone that's in a that hasn't fallen all the way down, that's either in a tall kneeling or a half kneeling position, that we do want to get them onto the floor. That's the easiest way to transfer. It's okay to transfer them onto their sides and then roll them flat on their back. You don't have to completely go forwards as we did in this scenario. So whatever is safest and easiest. Again, there are going to be all kinds of different situations that you have to problem solve and figure out what's the easiest for each person.